Um, we're going to have our agenda start today with our presenters and the discussion related to the draft proposal. Last month we had an opportunity to hear from Jason and got a little preview of the process that they experienced. And at this point, there are some recommendations that are being proposed. So we're really glad you could come back, Jason, and tell us more about what's going on. And some of us have had an opportunity to talk to our subcommittees and get some additional impressions about things that are going to be helpful. So, we'd like to share some of that with you also tonight. So, all right.
Mary, just before we get started, a reminder that this is being recorded as well as being live streamed.
Thank you. Great.
Great. Thank you, Mary. Thank you. It's good to see you all again. I have Deanna Carithers with me and Dominic Racchio. Both Deanna and Dominic have been a big part in helping manage the process and put the report together. They've been great participants in it. And I believe we're going to have some other folks join us as well that have helped with the feedback and input process. So when they come on board, if Deanna and Dom, just let me know. Oh, yeah, Deanna?
Yeah, Sean is here. He just has his screen off per our initial discussion. So Sean is here for the resource. He's here.
Great. Sean Everly Bradwell was part of the research group that did helped collect a lot of the information from the facilitations of groups, subgroups, and put it together along with Lisa Gonzalez and Shelley Michelle Nunn, also from the city HR department. The director of HR was a big part of helping put things together. Hi, Shelley. So, I'm sure the report was put out last Monday. I'm glad some of you had an opportunity to review it. What I'd like to do today is maybe go through. We have a quick slide deck to kind of touch on the key parts of it, kind of go through the recommendations briefly with you, and then be happy to have more dialogue, gauge feedback, and we'll take a lot of this feedback and then share it with the elected bodies so they can take that in as they start to review it and start to consider what it is that they want to adopt. So if it's all right, can I share my screen now? All right, let's see if I can do this. All right, can everybody see that? That would be, it says Reimagining Public Safety Collaborative Draft Report. Yep, get a lot of nod heads. All right, great. Okay, so this was a collaborative effort. It was a partnership with the City of Ithaca and CPE, the Center for Policing Equity. And this executive order came out and a directive from the governor in June, and the mayor and I talked briefly in July and said, a lot of the constituents that we're going to talk to through this process are going to be the same. And rather than talk to constituents, the same constituents twice, why don't we see if there's a lot we can do together under a collaborative effort? So we brought our teams together and developed this collaborative. And CPE, the Center for Policing Equity, is a group that has focused on equity work in the policing realm across the nation, and they've done this type of work with a lot of communities across the nation. So, little background and process. My screen here. Basically, this had a lot of different public engagement components to it. We started, I want to say, in September timeframe. And it started with, 5 or 6 different community voice forums where community members were offered the opportunity to give their perspectives on policing reform or the reform reimagining public safety. Where Belisa and Sean came into play was helping take over a dozen different facilitated sessions, the data from those professionally facilitated sessions, and putting that information together to be able to give us summaries of themes from that information. And the groups that were facilitated, they were facilitated by professional facilitators. Shelley and Dominic were a big part on the communications team that helped ensure that members from the community, from different subgroups of the community, were able to come together in a safe space. A facilitator facilitated their perspectives and confidentially, and then it was put together through the report that Belisa and Sean put together identifying themes that help feed a lot of the recommendations in the report. And that data is an attachment in the report. If you haven't had a chance to read it, I would encourage you to do, because I think it gives a lot of interesting background and a lot of background from what individuals and across a good sampling of the community said about what they experienced as individuals and what they wanted to see moving forward. Sean, you're here now, and I'd like to maybe just give you an opportunity if you wanted to elaborate a little bit more on the process that you went through just to put that information together.
Absolutely. Thank you, Jason. As Jason has indicated, as folks probably also know, Executive Order 203 was in many situations demanding that elected communities focus on the most marginalized members of their community, including the folks who probably had the most interaction with law enforcement. And so for us, what that meant was an oversampling of particular communities. And someone once asked, does that mean that the data is skewed? And my response is no, because the oversampling usually means no participation to some participation. And I hope that makes sense. So we ran focus groups with 15 differently identified communities, returning citizens who were coming out of incarceration, members of the LGBTQ community, in immigrant communities, Black and Latinx communities, Asian American communities, and the list can go on, but try to find very clearly the input that they would have about the process, and doing so using qualitative research methods. We also took a look at the community input. There was a survey of 5 questions, including a survey of 1 question that was both City of Ithaca and outside of the City of Ithaca county participation. We call that community input in some regards because the information was not gathered in a methodological way, but still provided input to what community members thought was necessary for a reimagination. And so the recommendations, and my apologies, I have to stop calling them recommendations. The report that we put forward tried to capture the themes that were recorded from the focus groups, as well as some of the community input. So we were just trying to share themes with the authors of the report. And at some point in time, either myself or Dr. Belisa Gonzalez would be more than happy to answer additional questions.
Right. Thank you, Sean. As you can see, another component of the report is also an outline of the current state of law enforcement, where law enforcement agencies, both the Sheriff's Office and IPD, were able to provide input and provide insight as to what's going on in the current state of the departments. The recommendations took all this different input from different avenues, both law enforcement, the law enforcement work group, which consisted with both law enforcement agencies, the District Attorney's Office, probation, assigned counsel. Several others were all offered opportunities to provide recommendations as part of this, and then from there, we looked at these proposals and recommendations through the lens of Executive Order 203, and trying to identify which of these recommendations were consistent with eliminating racism in law enforcement practices, and that's what made its way into the report. And then I'll go through a little bit when we get to the implementation, or what's being proposed from an implementation perspective. This presentation, just from a color coding perspective, there's a few that are just city related, there are a few that are county related, and the blended blue and green dot is what we recommended collaboratively to work on together. So Shauna mentioned earlier, the tenets of Executive Order 203 is really about acknowledging and identifying discriminative practices in law enforcement, and how we were going to change that moving forward. What practices and what initiatives would be put in place that would end racism in law enforcement. And while this is focused and many times talks about policing and law enforcement, if you notice, our name of the report is Reimagining Public Safety, because we felt that public safety, there are other services in addition to law enforcement that need to continue to operate and look through this lens as they move forward. I mean, you'll notice that there are a few recommendations that are while related to law enforcement, aren't necessarily just regarding law enforcement agencies. But this is the guiding tenet that we looked at as we put the recommendations in this draft plan. So I'm going to get into the recommendations now. I'm going to talk briefly a little bit about each of them. I will say there are two specific city recommendations that are probably best left to the mayor to discuss a little bit more, but I can definitely speak to a little bit of them, and I can take into your questions and concerns about all of them as well. The first one here, replace City of Ithaca Police Department with a Community Solutions and Public Safety Department. This, as you can imagine, has gotten a big portion of attention over the past week. And what this means with replacing the existing police department with a different department, a Community Solutions and Public Safety Department. Again, I think the mayor is best positioned to talk about this a little bit more. I do want to stress that this is not eliminating policing, but is definitely approaching it from a different perspective. And I can talk a little bit more if there's some questions as we get into this. Going down just below that, better align available resources with emergency response needs by establishing a pilot program for non-emergent calls. So one of the recommendations that the sheriff had suggested is providing some civilian staff that may be able to handle non-emergent calls where individuals don't need a uniformed officer to resolve, and that can be anywhere from report taking, from complaint taking, or taking in complaints or questions to minor transactions. And I think we identified some of those transactions as an example. This is a pilot program that's intended to try out for a year, where we would be bringing on 3 additional civilian staff to help offset some of these non-emergent calls, as well as some administrative duties, so that law enforcement staff are available for more urgent needs and urgent calls. Evaluate existing models and implement an alternative to a law enforcement response model for crisis intervention and wraparound health and human service delivery. So this is probably this is probably one of the larger proposals and recommendations, and this is identifying and then ultimately implementing an alternative response model to law enforcement. So similar to a CAHOOTS model or an expanded community outreach model. Establishing what we think would work in our community and then implementing it in over a 12-month period of time, and how that would interface and interact with law enforcement, how it would be able to pick up calls or co-respond. I think co-response is probably a more likely point to make, is how they would co-respond with law enforcement, and how it would integrate into our response model in general to folks in need, particularly in crisis, and then also how that is going to be handed off to the health and human and social service environment to ensure that individuals get the services they need. I know we've had several sessions speaking to different folks involved in the CAHOOTS model in Eugene, Oregon, and this is intended to be something similar to that. Collaborative recommendations: identify new curriculum and redesign and implement the culture responsive training program that incorporates de-escalation and mental health components into a comprehensive response for law enforcement. So this was about identifying and really capturing a training approach that will not only continue on an annual basis for departmental staff, but also approaching individuals right when they begin in the department, before they begin into their field training program, to ensure that if they're not covered in the academy, we're able to provide the cultural responsive training that we're looking for, whether it's mental health first aid, whether it's de-escalation, and develop that curriculum so that our new employees go through this training before they even step into the field training program. Over to the right, develop a comprehensive community healing plan to address trauma and the relationship between residents and law enforcement. The biggest thing that we received in terms of the themes was that there was a lack of trust between law enforcement and community members. And there's a lot of trauma between the two, and a healing plan is the beginning place for starting to improve those relationships between residents and law enforcement. And this is something that law enforcement would be expected to participate in, as well as community members, so that some of that trauma can be talked about, can be addressed, and then hopefully new trust can be built within the community. Develop a comprehensive, inclusive, and innovative recruitment strategy for law enforcement and correction officers. This again is working with our HR departments in both the city and the county to approach this from how do we reach out to marginalized members in our community members from our BIPOC community, to be able to get interest and engagement in these types of careers. we're underrepresented when it comes to law enforcement officers in our community demographics, and we want to be able to expand that net and improve our recruitment efforts. Also, we want to be able to ensure that we're recruiting and hiring future officers and future law enforcement officers that are consistent with the values that we want in our community. Develop a countywide approach to promote and support holistic officer wellness. So in our probation department, we have a state-recognized peer-to-peer support program. This was brought up by both departments as something that they would like to establish in the community for law enforcement, as well as ensuring that we have adequate mental health support for our officers as they go about their day-to-day duties, and help them manage when needed to deal with the experiences that they face, as well as law enforcement officers. Standardized data entry and review existing data sets for more actionable insights and allocation of public safety resources. So one thing we identified as we went through this process is we were pulling data out of the records management system at the county, is that there is not a standardized approach to the way the different law enforcements enter data into the records management system, which is Spillman. And as a result, if you don't put in good data, you're not going to get good data out. And in order to make good decisions, whether it's about operations or understanding how the department is functioning, if we can't pull or extract data out, in a consistent manner, we're not going to be able to draw good conclusions. So there really has to be a revisit with all the law enforcement agencies and they all use the same records management system, Spillman, as to ensure they're standardizing the way they enter it in there and standardizing the modules they're using, and that it's consistent as new officers come into the system, that they're continuing to use it effectively. It's definitely a system that is underutilized because of its inconsistency in the way different departments use it. Develop a real-time public safety community dashboard. Again, this is tied directly to the type of data that's put into the records management system. You can see many communities throughout the country have a real-time or close to real-time dashboard that provides some limited information or public information about types of calls, frequency of calls, location of calls. Sometimes these GIS tools allow you to query information online to develop data sets. That's part of the transparency piece of law enforcement activity, and developing a community dashboard would directly tie to the first standardized data recommendation. But it's something that feels important from a transparency perspective and a disclosure perspective. Collect and evaluate the results of officer-initiated traffic stop enforcement. So this is a county initiative. Currently, the county does not collect demographics related to its traffic stops. That said, traffic stops are probably the most frequent contact a member of the community would have with law enforcement. And what we identified from what the data we did have was that over 75% of the traffic stops that the county encounters are issued waivers, and of the 25% that are issued tickets, less than half of them are actually or I would say more than half of them are fully dismissed. And there's no interpretation, no understanding of the demographic impact and of traffic stops in general as a function of the sheriff's office. It's also known that across the nation, there's definitely a disproportionate contact minorities when it comes to traffic stops. So part of this initiative is really starting to collect the demographic information to understand how we're doing traffic stops and if we're doing it in the most effective way, or maybe we should change that practice. SWAT-related recommendations. These two recommendations, one is repurposing the SWAT vehicle, the mobile command center, to the Tompkins County Tompkins County Department of Emergency Response, and develop policies for use around the mobile command vehicle. So the SWAT vehicle is a mobile command center. It's not an armored personnel carrier. And it has multiple functions that could be used for multiple purposes throughout the county from an emergency response perspective. And this initiative is shifting this vehicle to emergency response, but also developing policies for use as to how it can be accessed by other agencies, including law enforcement in the future, to make best use of the asset. The second piece of this is conduct a review of the SWAT callouts to determine the appropriate use of service and equipment. This is doing an evaluation of the existing callouts to determine if the resources were adequate, if they were inadequate, if it was necessary to call them out. And I'm trying to make a determination as to what is the level of SWAT service that should be entertained moving forward, and what's the level of training and capacity that this unit should have moving forward. Advocacy recommendations. So these are all recommendations that would go to the state of New York. Part of this, I think, requires partnership with the state to change some of its rules and policies and laws to allow for our ability to recruit better, to diversify our workforce better in the law enforcement realm, but also to discipline more expeditiously with respect to law enforcement. So the first one on the top left is more of a statement to New York State saying that the troopers work and operate in our county, and we would expect them to collaborate with us on our expectations and service delivery to our residents. And we want to bring them in these conversations, whether it's data collection to how we want to handle mental health calls moving forward in the future. Advocacy to New York State for continuous recruitment and civil service exam changing. This has to do, you're probably all familiar enough with the mental health department. As in most municipal governments, a lot of the positions are civil service competitive positions, meaning they have to take an exam, a civil service exam. Law enforcement's no different. The ability to recruit quality candidates many times is hindered, and our ability to recruit diverse candidates is hindered by the civil service system. So we're looking for some changes to this to be able to recruit better. On the last one, as urging the state of New York to change its civil service law section 75, which is reforming the discipline procedures for law enforcement staff. Currently, this process can be lengthy and elongated, and it does not allow for swift review of disciplinary cases from an accountability perspective. We want that to be changed as well. From an accountability perspective, the city has requested in one of its recommendations to increase the community police board's authority and oversight, particularly asking for subpoena authority and the ability to issue discipline for law enforcement. The Tompkins County Public Safety Review Board is simply asking and having the dialogue with the legislature that do you want to create a similar type of citizen oversight board for the sheriff's office that currently does not exist? So some type of either advisory or oversight board that would be able to look at anywhere from use of force to disciplinary measures within the law enforcement department within the sheriff's office. Require public disclosure of district attorney and assigned counsel's office statistics. This has to do with, well, everything up to date really has been talking, primarily about law enforcement agencies. The prosecutorial side and the public defense side of things has not been talked about. So we think there should be more public disclosure of some of the statistics in the district attorney's office as well as the assigned counsel office from a transparency perspective as to what's the activities of those offices and outcomes of those offices. And lastly, the creation of the Community Justice Center with new staff and resources made available to follow through with the recommendations. So this last recommendation is about adding human resources and capacity to be able to help manage the process of implementing a lot of the recommendations identified in this report. And the way I relate it in the report is, I think, and this may be bias of me, but I think Tompkins County has responded probably the best of any county in New York State with respect to the COVID-19 response. We have the lowest infection rate. Don't let this go to your head, Frank. We have the lowest infection rate. We have one of the highest vaccination rates. And that's because we put the human resources and the monetary support behind that initiative to be able to combat what it is that we needed to combat at the moment. It's been over just about a year now, believe it or not, that we've been dedicating resources to it. Well, that's because we dedicated resources to it. And I think if we really want to make a serious effort of combating systemic racism in law enforcement and implementing these recommendations, we have to put the human resources towards managing the process, helping facilitate the conversations and managing the initiatives, because you're dealing with multiple departments and multiple agencies across multiple jurisdictions that are going to have to participate over a period of time. And that can't be just put on the responsibility of existing staff to do in addition to the normal duties. We have to dedicate sole resources to ensuring that we can follow this process through to be able to be successful at it. And that's what this is. This is adding 2 staff. And essentially the Community Justice Center, if for lack of a better term, it is no different than the Emergency Operations Center. It's the EOC for managing this process. What's next? Dozens of sessions like the one we're having tonight, where We are here to engage with different groups to get their feedback, get their thoughts, get their questions. I already have, just so you know, several meetings set up with different county departments, probation. I think I'm meeting with the mobile crisis team, Frank, and some folks from the mental health department. You know, we have a few other folks that want to talk. We're fielding a lot of questions from different individuals. We have multiple different sessions with other groups in the community to kind of go through this presentation and have some dialogue with everybody. And admittedly, to hear what your concerns are, to hear your compliments, your questions, your suggestions, which will hopefully we'll be able to give that feedback to the legislature and help mold these recommendations further so that they can make good decisions moving forward. Then the recommendations have to be considered and adopted by the legislative bodies. So the Tompkins County Legislature, as well as the Common Council, separately have to adopt plans. It can be a partnership, but they have to legislatively take their actions separately and submit those plans to the state of New York by April 1st. The reason I say it's a living document is because if we adopt a lot of these recommendations and then put the financial resources behind them to do them, then I think the question comes into play is that this will change and evolve over time, right? As we begin to make certain investments in the community, we'll revisit this and revisit what are we doing right, what are we doing wrong, where do we need to improve upon or shift resources to and from to make it work. So when I say it's a living document, I don't think this is something that you do and then start to check the boxes off. It's a continual effort, and frankly, it's a continual cultural change as we go through this with multiple departments and agencies as we look at how we are eliminating systemic racism in the different work that we do in the public safety realm. Again, not just the law enforcement realm, in the public safety realm. Implementation, it's starting with putting the dedicated resources to it and then continuing with community engagement as we go through this process. Where we got to these recommendations was with extensive community engagement and feedback, and I think as we go through it, that will continue to keep it in the right direction, and that feedback loop model will be important so that we know when we're making decisions, they're consistent with the expectations of the community. So, so that's a very, very brief overview of the 100-page report, which I know you've all read and multiple times. And I guess before we move on, I'd like to open it up just to Deanna and Dominic, if you have anything to add, as well as Dr. Bradwell and Gonzalez, if you want to add anything before, that I may have missed through this rather brief presentation. And Shelley as well. I'm sorry, Shelley. I see nothing. They're shaking their head no. Yes, Deanna.
No, I was just going to say, just to close the loop, I know that Jason said this before, I cannot stress enough that the purpose of Executive Order 203 was to look at marginalized populations. This report is not about winners or losers, anything like that. It's about understanding the needs of those who feel unseen. One of the things I think Dr. Gonzalez and Dr. Eversley Bradwell say that I try to say in all these presentations, there were two things from the research report that we found to be conclusive. One, both sides, neither one of them trusted the process. And so, and then both felt that both law enforcement felt, and then marginalized populations felt like they didn't know enough about the other. And I'm hoping that through this process that we can continue to build those bridges, and knowing that the work won't be easy, but also people of color have told us this is your last chance to look at this with us in a meaningful way. And I hope that we take that charge seriously. Dr. Gonzalez, I'm not trying to steal your lecture like that by saying these things, but I've been taking these things to heart as I listen to these things. What we're finding is that people have stopped reporting, they've stopped sharing. So when we get the question of where's the data results in health disparities, people having hypertension, all those different things, people are becoming sick, escalations in our law enforcement responses because people don't call. And so how do you measure those things? And so we're encouraging folks to take the process seriously. And I believe that you all are, because you're here today, but also feeling like we don't want to lose this opportunity. Again, one thing I've said to Dominic, people will say sometimes, we are not Minneapolis, we're not those other places, we're not Ohio, those places. We shouldn't have to be. Some of these things are prevention, right? Some of these things are about making people feel safe in and above Executive Order 203. public safety, when we say liberty and justice for all, the question is, do we really mean for all? And then when people say that they're taking, when you say public safety, for whom? And so this report is seeking to make sure that all marginalized populations feel as though when they call law enforcement or they enter our system, whether it doesn't have to be necessarily law enforcement, when they call, when they're in a judicial process, that they feel like their concerns are heard. So I'll stop there, but I think just wanted to elevate some of those things because I don't want this community to miss out on this last opportunity for folks of color. One of the last things that we saw is some folks wouldn't talk to us because they didn't believe. And so I could say that Dr. Gonzalez and Dr. Eversley Bradwell leveraged relationships here. I think Sean says it best, or Dr. Eversley Bradwell says, they hung a phone in his face because they didn't believe in the process. And so I know they won't tell you these things, but I lift those things up to speak to the severity of the pandemic that people of color are experiencing on top of COVID-19. And it's not an understatement to use that language, and that imagine, folks who are on this call probably experience those, have these conversations with folks. And so I'll stop there, but I just encourage you to take this seriously. Please share, or please understand where folks from marginalized populations are coming on. Most folks on this call have never met me before, but this is why I'm here for this particular issue only, is to focus and to make sure those underrepresented voices are not drowned out, and to make sure that we understand what equity looks like. And equity, diversity, equity, inclusion belongs to all of us. And so there's always going to be a time where we feel unseen, we feel devalued, we feel like we're not seen. And so we're asking for those folks to have the same equitable opportunities that we all believe that we have, we deserve as humans.
All right, thank you, Deanna. So I guess, Mary, I'll turn it over to you as to how you want to, how you like to proceed with the meeting. And
Sure. Yes. Thank you so much. That was really helpful to see it laid out in that kind of clear way. We appreciate that. I'd like to open it up to the members, particularly if any members want to provide feedback that their subcommittees discussed, but certainly others. So who would like to start? Khaki?
I have a question, I guess, more. And I'm not sure how to frame it, so I have no agenda behind it. I just want to make that clear. But why, it seems like there's such drastic different recommendation related particularly to structure for IPD versus the sheriff's office. And I'm just curious as to sort of how that came about or what the reasoning was behind it. And again, no agenda. I'm just asking the question.
sure. I can only speak to the county side of things, and looking at the approach we want to take. They're similar in certain elements, but they're obviously the IPD's restructuring is significantly different than what's being proposed from the sheriff's office, or what I'm proposing. As far as the sheriff's side of things, the ability to hire some civilian staff to be able to offset administrative responsibilities, offset certain non-emerging calls, I think was important from a resource allocation perspective. Be able to have your uniformed officers available for the types of calls that are more urgent. The other component, which is the alternative response model, in my mind, is a countywide approach, not just a approach outside the city. It's a countywide approach, since this is more along the health and human service side of things that we provide as a consistent basis. So how we would go about implementing a cahoots model from our perspective is something that we would look at countywide, including the city, just as our mental health department provides services to all county residents, regardless of where they live or what jurisdiction they live into. That was really, those two recommendations we felt came from the information, the feedback we received. Again, I'd have to defer to the mayor as to why he felt that was an important change on the IPD side of things. I don't want to speak on his behalf, so I apologize for that. But I think from the county side, from those two recommendations, that's from what we saw with respect to the information feedback that we were getting.
Elise, did you have your hand up?
I did. I have a couple of questions. So first, you referenced a survey And I'm wondering is that survey instrument in the aggregate responses publicly available somewhere? And if not, can we get that?
So can I respond? I'm not sure who used the word survey, but as a methodologist, I would not use the word survey.
Okay.
And so, but people commonly use this term to refer to questions that you send out to a group of people. And the reason I wouldn't call it a survey is because it doesn't rise to any methodological standard in terms of outreach, in terms of vetting questions about order, wording, and depending on which, and again, I'm not sure who mentioned it, but depending on which input source we're talking about, one of them really just asked the executive order question. So, you know, there's sort of a direct translation there. And then another one was a one question, you know, again, I struggle with not using the word survey, but a one question instrument that was designed to just ask folks to give us like input on what they thought about reimagining public safety. And that question was the same question that was used to guide the community voices forums that Dominic put together. So I don't know if Sean or Dominic or someone else wants to speak to the survey.
So and it wasn't a representative sample.
No, not at all.
Okay.
Yeah.
So
and we have very few. Yeah, we have very few demographics on that information also. So, and multiple people, the input mechanisms were set up in such a way that multiple people, or sorry, one individual could give the same response in several different forums. And we know for a fact that a handful of folks did that, and we suspect that other people did. Not to be malicious or anything like that, but it is then difficult to actually know how to weight that information. And so in the report, Sean and I were very careful to call one set from the focus group data and the other set community input, just to try and make that methodological distinction.
Okay, that's fine. And so I guess my other, I don't know if it's a question or a statement. I suppose I heard, and I guess it's complicated, right? Because we do have this sort of dichotomy of the county approach and the city approach, which makes it difficult to have a conversation about this as one report. But I hear some inference to implementation science in the report. I hear people talking, referencing things like implementation teams and feedback loops. And that's encouraging, but I think I'm very concerned about, from a process and a systems change perspective, how we would, as a community, sunset a police department while simultaneously building a Department of Public Safety. That I'm having a hard time imagining, even with careful attention to principles of implementation science. And so while I think that all the recommendations in this report are sound and good and necessary, I'm extremely concerned about implementation. And I think the addition of 2 staff, that's certainly a step in the right direction, but it's a massive undertaking, and I'm not sure that 2 staff, even if those staff are directing community work groups, I still see this being a bit of a tangled mess.
I think your point about implementation is right on. And so and we're working now a little bit more on timeline and some things, so several things to think about. One is there will be county and city staff that will support certain initiatives. For example, some of the data work will include our ITS, our dispatch group, and our dispatch director, and other county staff that will help support. So I don't want to leave the impression that just 2 staff members are behind to do everything by themselves in isolation. Obviously, every single initiative will require a joint team of some level of city and county staff, and probably other agencies, whether they're other government agencies or NGOs that will participate in helping them become a reality. The time frame is varied depending on what they are. So some of them are going to be advocacy driven at the state level, and some of them will be within less than 6 months, some will be within 12 months, and some will be obviously much longer. So I think that still has to be outlined to be able to practically understand how you would approach it and allocate your resources towards it. The first recommendation on the city's change in IPD is one that I can't speak to as to how they would approach it. I know the mayor has discussed that this is something that would happen over time and be phased in over time, but I don't think details have really been worked out as to how that would go about happening. So I can't really speak to that, but implementation is a concern, and frankly, my perspective on this is the 2 staff that we feel would be dedicated to this. This is their sole work. This is what they're going to help organize, what they're going to help move forward, which just from the COVID response, I can tell you, having several people dedicated to that response, where that's mostly their sole work, has what's been a huge ability to be able to lift resources and do what we need to do, particularly from collaborating with partners. And that's the only way I can see this work being successful in the long run. So it's a point well taken in terms of resource commitment to implementation.
Sheila?
I'm interested in hearing more about the healing plan. How do you envision that unfolding, and will you be tapping local expertise in this plan and helping kind of to facilitate aspects of that healing plan?
Sure. Deanna, do you want to talk about that a little bit?
Sure, I'd be happy to. So first and foremost, what the healing plan is to begin the process of bringing people to the table that have already written the process off. Folks who don't trust, folks who refuse to give any kind of feedback or say anything. Those folks who don't use our systems whatsoever. When we talk about the healing plan, we would see that as an external person in consultation with the key stakeholders working on this process. We know that some folks are so close to the process here, that they can't see the forest from the trees, right? We use that same methodology when we work with the law enforcement folks specifically. We had CPE do those focus groups because specifically we knew that there could be questions about the efficacy of the process. So specifically, when we say we want to develop a healing plan, there are strategies that are actually outlined in one of the appendices here that speaks to what is trauma-informed community building work. So how do we identify who those parties are? Where is the level of trauma, and how do we bring those folks out? And then also, how do we engage law enforcement in those same conversations? And so again, that's meant to be a ground up approach. The ultimate goal is to lead to a more community engaged process in terms of procedural justice. We can't do any of those things in terms of looking at an unarmed response potentially, or having any kind of those conversations with folks if we don't look at what healing looks like. And that goes on both sides specifically. And so this would be another process design. This is another process design recommendation, because our community has never done anything like this, right? So when we talk about folks who feel like they've been marginalized and they've been in the system for 20, 30 years, what does that look like to re-engage and bring those folks along? And so again, the plan is to develop a comprehensive healing strategy. Some of those things include, let me just take a step back. Base level is we have to identify what the needs are of those populations first and what that healing looks like. And then from there, develop a process and strategy to address those things. Does that answer your question, Sheila? I think it's Sheila.
It does. I'll be interested, to learn more as the report, when there's more conversation around the report.
Sheila, we can't hear you, Sheila.
Oh, I'm sorry. Yes, thank you. That was helpful information. I'll just be interested to see, how that conversation and the plan unfolds as we go forward.
Sure. And then also, Sheila, I'll attach one of our attachments here. Again, it's a very preliminary thing without giving too many details, because a part of it is we have to know who we're talking to first, right? So we have to develop, we have to implement the plan. And so we wouldn't want to design anything prematurely in that way, because a part of it is if you don't trust the system and you design something for folks, they're going to say to you, you didn't listen to me. You didn't see where I came from. And so a part of that is taking one of the things we asked Center for Policing Equity to work with us on was taking us through that process. What does that look like? What are the strategies? What does that look like? And so we would be working with other experts in the field to develop a trauma-informed plan.
Okay, thank you.
Larry, did you have your hand up? I think you're muted here.
So I'm going to ask these questions before, and then see if anybody else has questions before I give my report as the chair of the subcommittee, because I have some questions about other things. And they're sort of purely political. One is, what do you think the fact that the police unions, both the PBA and the Sheriff's Association and law enforcement officers from contiguous counties have clearly stated their absolute opposition to this process and are calling for the process to be reopened, even though the process isn't closed. So what do you think the impact on such strenuous and organized opposition is going to be to the process of implementing? And the other is, I'm wondering what the support for the executive order and this process is in Albany in case the governor needs to or will step aside, and then also even if he doesn't step aside, will he be able to manage this process at the, so what is the current situation? How does that impact what we're trying to do here?
Okay. Both good questions, and I don't know that my answers are going to be, are going to be the right answers, but I'll tell you what my personal perspective is of it.
Cool.
I'm aware of the union's objections to the plan. It was disheartening, to be honest with you, that nearly all the comments really did not talk about anything germane to Executive Order 203 and acknowledge what it was intended to do and what it was intended to approach. So I think that's unfortunate. That said, I'm always hopeful that through this process we can change minds and work with folks towards better outcomes and solutions. I don't feel that that press conference was particularly helpful to anybody in this process, but more so to those individuals because it's going to involve them as we move forward. I don't know if there's really anything else I can say about it other than it's unfortunate, and I wish they had different perspectives. And I don't think it. This Executive Order 203 is not about them. It's about individuals that have been negatively impacted with respect to racism in the law enforcement field, and that's being missed drastically and significantly in that group. So I don't know that I have anything else to say about it. As far as Albany, Albany's interesting. I'll just be honest with you. It's a little bit of a roller coaster. I don't think, my perspective is that the Assembly, the Senate, and the Attorney General are very supportive of the executive order. They were supportive of it when it was issued, and I would hope their support would continue regardless if the governor is in his current position or not, or another governor, or whatever the case may be. I don't think it changes anything in terms of its intent and the current circumstances around what people have experienced from law enforcement, and I don't think that should really matter who's at the helm over there in Albany, as far as I'm concerned. So I would actually, these plans are expected to be delivered to the adopted plans are expected to be delivered to the Division of Budget. The governor's executive order basically intended to withhold state aid if you didn't do the plans. My hope is that once delivered to the Division of Budget, the next step in this is that the state would then require folks to implement these plans. And it would sure be helpful if they wanted to help us and partner with us in putting financial resources to it. And if they don't, then they don't, and we continue to move forward. I mean, the question was posed, is this an unfunded mandate? And I said, it's not an unfunded mandate if you feel it's valuable to the community and to the constituents that you serve. So, the governor's there, great. If the governor's not, and we have a different governor, then I would expect that wouldn't change on our end. This is a community-driven. This is a community-driven plan, to be honest with you. And if the community wants to do it, then we'll move forward with it. And that's the advocacy points in this plan, while important, if not adopted and enacted by the state, which is a big lift, wouldn't hinder us from moving forward with the rest of the recommendations. It might create, it doesn't pave the way for us, and it requires us to be innovative and come up with new solutions that we need to, but it's not going to prevent anything from happening. That they're not linked to any other recommendation, and it wouldn't prevent them from happening. It would just be better if they did. Does that answer your question, Larry?
Yes.
Okay.
Larry, did you want to continue for a minute or so? We should be
Sure. So for people who don't know, I'm the chair of the mental health subcommittee that advises this group on mental health needs in the community. We have a pretty extensive mental health community in this county that involves both the Department of Mental Health and another clinic, and involves lots of nonprofit organizations doing good work in the community. And what the mental health subcommittee is charged with is discussing issues and identifying gaps in services and recommending and shepherding possible solutions. So I was hoping to include this document in the chat, but I couldn't figure out how to do it. I tried to cut and paste, but it cut off at a certain point. I'm not going to read the whole document because I can send it to you. What I will do is say that our comments, both as a group and as from individuals, sort of broke down into two issues. One is the training of officers and the training of anybody who is working with or intervening with people who are in mental health crisis, often with, or predominantly when we talk about reimagining, the reimagining initiative, we have immediately focused on emergency response, and the models that get talked about are often geared towards that. So this is in some ways why the why the comments and the issues we raise are aimed specifically at that. So the other main group of comments or ideas have to do with how would we revise or redevelop or reimagine response to people in crisis. We have a lot of resources in the community, such as the emergency outreach program. How would we or should we combine that with something else like the CAHOOTS model? Is there a role for 211 as a resource? What kinds of training can we do in this community that helps to increase everybody's awareness of mental health? Because part of the problem, of course, is that we rely on police and well-trained social workers because situations get into crisis. So how can we develop something where crises don't develop, and where the whole community feels an engagement with supporting people, whether they whatever disability or mental health diagnosis they might have. And I wanted to add something that I relayed to Jason at another meeting and to a group at another meeting, which is often when these kinds of reports get written, disability is seen as sort of a specialized part of the planning document or the input documents. And sometimes the special needs stuff gets organized into appendixes or special chapters. And I really think that the document, when it's finally talked about by legislators and policymakers, needs to sort of treat disability, whether it's mental health or substance abuse or developmental disability, as a major aspect of the plan. Because in the end, when we're talking about reimagining policing, what we're talking about, as Deanna was saying, we're talking about communities that have contentious or difficult or specialized relationships with the police, and with whom the police have relationships. So I'll send this by email so everybody has the list, but I think that does it. Mary or Frank, do you think, did I miss anything?
No, I think that covers it, Larry. Yes. Yeah, thank you. And emphasizing how upstream can we get to try
Oh, yes.
to
That's
prevent.
the other thing, the upstream stuff. What can we do before people get into crisis?
Yeah, if you could forward, we'd be happy to take a look at what you have, Larry. And
Yep, I will. And I'll forward it to I'll ask Karen to forward it to everybody.
Okay,
Thank you.
Have I missed anyone who was wanting to contribute here? Kaki?
Well, I just want to, and Maria has her hand up too. I just, on a slightly different note, I just want to thank all of you who have joined us and who've been involved in writing this report. And I want to say that I'm proud to be a member of a community that's at least attempting and hopefully will be successful in sort of ripping off the Band-Aid and really refocusing the conversation. Because I think that we can't really make progress without that. And so we can talk about the different details and stuff of it, but I wanted to make sure that that you all knew that at least I, and I'm sure there are others here, are really proud of the work that's been done.
Thank you.
Thank you.
Thank you.
Shauna also had her hand up, right, Shauna?
Okay.
I just wanted to say the exact same thing Kaki said. Thanks, Kaki. And thank you all.
Maria?
I add my voice to that. It was a very thoughtful and a dedicated project, and I'm proud to be a part of it. The one thing that I would like to add is that whenever incidents or interactions occur that decrease trust between public safety officers and members of marginalized communities, it is an individual failure, but it's also a systemic failure. And what I saw in the proposals were several ways of addressing those individual challenges, but I did not really see a tremendous amount of how to address the systemic failure that reflects. And so I think it could add something if we were to say that when these incidents occur, what the review process will be. Are we going to look at our training? Are we going to say, you know, we have the right training in place, this person just didn't implement it? Or are we really going to look at our training and say, if they didn't implement it, maybe that's our failure because we did not give them the tools to know how to implement it at the time for the right purpose. So I would like to see, as a piece of this, in addition, I fully agree with what is proposed, and I think we need to also think about the ways that our system, from the person at the very top to the direct care individual who's interacting in those very stressful moments, how the entire system supports the increased level of trust that all of our community members should feel in the public safety group. So that was just the piece I wanted to add.
Right. Elise?
Yeah, I mean, I think, to Maria's point, I think, creating those decision support data systems that are described will go a long way toward starting to at least understand, where it is in the system where things are falling apart. The one thing I'm a little bit worried about is the fact that there's a lot of pre-service. So there's attention to, what we would refer to as competency drivers in terms of the knowledge, skills, and abilities of armed police officers in our community, and maybe, improving the knowledge, skills, and abilities over time so they can more equitably respond to the needs of the community in terms of public safety. But there's also a pre-service element there. And I don't know that are there any reforms being made to the process in the state of New York of educating police officers, police academy reforms, because we are still going to get the same product out of police academy to work with, if that's the case, if there aren't reforms happening at both ends.
Elise, you bring up a really good point, and to say that we can't add another. This is an advocacy question, really. Your point being is that if you continue to train police officers and law enforcement officers the same way you trained them before, you're going to get the same product or the same outcome at the end of the day. Product's the wrong word. Outcomes, yeah, probably the best. And I know in reading some other robust reimagining, public safety initiatives, particularly the city of Rochester's, and we've had this discussion internally. There should be an advocacy mention of the way police officers and law enforcement officers are trained has to change as well. And I think it's a good point that we should make note of. And, we've talked about recruiting differently, but at the same time, we're sending them to the same academy that was the same academy last year, the year before, and the year before, and the past. Okay, well, the criminal justice, Division of Criminal Justice State of New York has to come up with new criteria as to how they want to train law enforcement officers, what the expectations of training are in the background of law enforcement officers moving forward. So I think it's a great point. I want to write it down because I think it's an advocacy point that I know we talked about, and it didn't work its way into everything. But there's a few of these things that I think have come up that we need to add to and bring up. So I appreciate that. That's a very good point.
Okay, we should probably be wrapping up, but Tom, you have a comment? And
I had a question. Is the jail personnel included in this change? Retraining?
Is the jail personnel included in this change?
That's a good question. I would envision that this type of training currently, if it exists, is offered to both the jail side and the deputy side. It's not. I don't think it's specifically outlined in this, but I think your point is that it probably should be. So I can't speak as to what's happening now, but we can definitely look at it as we move forward, because I think it's equally as important on the jail, the correction officer side of things.
Because I think one of the problems is the fact that they farm out people from our jail to other jails, where there's a totally different system and attitude and all that. So a person could be gone from here for a whole month under some other kind of jurisdiction and philosophy, which could differ significantly from ours, or the new one.
Okay, thank you. All right, does any other last questions here? Sean?
My apology, it's not a question, but it's a quick response to something I heard, or two things that I heard. Before I do that, my apologies. We also need to acknowledge the significant work that Shelley Michelle Nunn did in leveraging personal relationships. So both Deanna and Dominic have done amazing work, but Shelley's work of organizing a community and communication response was absolutely fantastic. So Shelley, greatly indebted to all that you've given and all the work that you have done. I completely understand that we find ourselves in a very political moment, right? That maybe some of the ways in which some things could have happened could have been handled better. That part I get, and it has shifted the conversation. But that idea about addressing systemic failures and trust, the job for Belisa and I was not to write recommendations at all. It was simply to lift up what people were saying in some of the focus groups. And it was very interesting what members of the focus groups were saying very clearly about how to build trust. Definitely talking about hiring, even though I greatly get the point about police academy reforms and training. Definitely talking about training, that the training needs to be significantly altered and from outside folks providing expertise. That was clear and very distinctive and defined ways about how we do the notion of training. There was a lot of conversation about any unfortunate situation of officer misconduct, what happens during those situations, and transparency. That was something that folks were picking up all the time. And one of the things that caught both, I shouldn't say caught us off guard, Belisa and I, in terms of reviewing the qualitative data, that folks were focusing a lot on the day-to-day operations of simply building relationships. There was a lot of conversation about law enforcement and community relationship building that has broken down. So those were some of the ways in which, from reading the qualitative data, that I would say that would be helpful to building trust. I know we're going to focus parts of our other conversation as we go through the process elsewhere, but I don't think we should lose sight of those key ideas that would go a long way to helping us build trust as a community.
Very good. Thank you. All right. Well, I so appreciate the presentation and the dialogue we've been able to have. Thank you so much, Jason, and your whole team here. It's really enlightened me as far as what went into this process, and I appreciate the opportunity that we have to contribute to this. Thank you.
Thank you very much. Appreciate it, Mary. Thanks for everyone's input. And I would offer this also, if there's questions that come up, you have my email address. Anybody can email me or anyone of our team about any questions you have. And if you want to have a conversation, same thing, shoot us an email. We'll set up a time to talk. I know I've got a lot of members in the community that want to talk, and we're doing the best we can to talk to everybody. So as long as you don't mind talking after hours, we'll be happy to give you a call if you want to just talk one-on-one, because we want to get your feedback and your input so we can share it. So thank you very much. Have a good night.
Okay, thanks.
Hey, Harmony, have you started yet?
Next week, Monday.
All right. Well, I'll see you then.
Okay, thanks.
Take care.
All right. Thanks, everybody. That I feel like I have a much better understanding at this point. So thank you for your questions, and it was a good presentation. We have about 20 minutes left, so we're going to fit a lot in. So I had a few things to mention. I wanted to remind everybody that, well, let me just go back. We should probably do the minutes first here and get those completed, the minutes from February. So you've all gotten a copy of that. Would someone like to make a motion?
I'll make a motion that we accept the minutes as presented.
Okay, and Khaki, would you be a second? Okay. Any discussion about the minutes? Okay. All in favor of accepting the minutes for February? Okay, they're passed. All right, so just let me go on to the chair's report. I had a couple of things. I wanted to remind everyone that we have a meeting on March 19th with the Department of Health, the Board of Health. It's from 1 to 2, and it's going to be a presentation of the strategic plan that has been worked on. So it's a joint meeting with them, and it'll be an opportunity for discussion and feedback on the plan.
What's the date again, please?
Friday, March 19th.
Thank you.
And I don't know if a Zoom has gone out yet, or it will be coming out shortly. but Karen is organizing that.
It will be.
Okay. All right. And the second piece of business I had is that I've received a letter of resignation from Harmony from her position on the board. So I'm not sure about process. Do we need to accept this, Frank? Is that the, no?
No, it goes to the legislature. You guys didn't appoint her, so it's really them that has to accept it, but there really isn't a process. It was more a formality because she obviously can't be the deputy and be on the board at the same time.
Right, sure. Well, I just think the only way she could leave is to become the deputy in my mind. So I'm glad we're going to still have her with us. It's wonderful. So thank you, Harmony. And just so you know, her note says she's looking forward to working together with the board in addressing the disability needs in Tompkins County. And she goes on to say, while we've experienced many challenges over the last year, I believe our future remains bright. And she thanks all of us. So thank you. All right. So Frank, did you have a brief report?
Larry has his hand up.
Oh, Larry, sorry.
As we're recognizing resignations, I'd like to let the board know that Leslie Connors, a longtime member of the mental health subcommittee and a longtime staff member at the mental health department, has resigned from the subcommittee. So we have an opening, and I'm meeting with Mary sometime this week to go over candidates, of which there are several. So things are moving along in that, but I just want to recognize Leslie's service to the subcommittee and to the board.
Mm-hmm. Thank you, Larry. Yeah. Yes, Leslie made a lot of contributions. That's right. All right. Frank?
Sure. Just to be quick, I don't know if folks saw, but Family and Children's has a new executive director that is starting, and I apologize, I can't remember her name, but we were excited to know that Harmony would have someone in her cohort that's kind of starting at the same time. So there'll be a great opportunity for them to learn together. Karen Shasher is going to stay on in a consultant role for a little bit of time to help with the transition, but she is now officially retired from that role. The department itself is doing well. Our demand for intakes has slowed down a little bit. And we've also been able to streamline the processes a little bit. So I think things are running fairly smoothly to getting folks in quickly. We are also moving towards heading towards more face-to-face opportunities in the building, both for people to come in and still do telemedicine in the building, but come to us, and also to use some of our larger spaces to do some face-to-face work. So that is ongoing, and we'll keep you guys updated as that progresses. On the state level, probably the biggest news going on right now, well, besides budget, because that's always big news, but the merger between OMH and OASIS, that is winding its way forward. They've had some listening sessions. I think we've shared out some information as those have happened. It's an interesting process. On one level, it's fair. It feels like they're including a lot of voices, and then on another level, it feels like it's a done deal and they're just pushing forward with it. So I think ultimately it's a good thing. I think one of the challenges we faced is the disparity between the two state agencies and how we're trying to approach the needs of the people we serve that often have both comorbidities. So I think it will be a good thing. The important part will be to continue to monitor and provide feedback as appropriate. Otherwise, I think that's it. Mary, I'll stop so you guys have time.
Okay. Any questions for Frank? Larry?
So there were two questions, but I can only remember one. Can you talk, have you been able to reach out to the executive director at Mosaic to arrange for him to talk to us about the changes at Challenge?
Yeah, no, I have not. I did get his contact information and I have it. I have not had a chance to make that connection.
Okay.
I do think there's still some mechanisms that have to happen for the two organizations before I think they would be willing to have a conversation, but I do intend to ask soon. I apologize, I haven't gotten to it just yet.
Yeah, no problem. I'm just glad that we're going to be talking to the right person. I mean, I think the sooner the better. Oh, and the other is, can we invite the new ED at Family and Children's to an upcoming meeting?
Sure.
Just so we can stare at our competition. No, I didn't say that.
Yeah, and Dr. DuPont put her contact information in the chat. It's Alicia Kennelly. And so, yeah, we'll definitely make sure you guys get introduced. We're going to get her introduced to Harmony pretty quickly too, so they can, learn together both about the community and their new roles. So yeah, absolutely.
Thanks.
All right, well, I think it's time to go into executive session. The nominating committee has been meeting and has some things to talk about. So can I have a motion to go into executive session? Okay, Sheila and Tom second. Okay, all in favor? We're going. Okay.
Okay, 1 second. I just gotta make sure that Greg gets the YouTube turned off. I just texted him.
And Mary, I should probably leave at this point. Is that correct? Okay.
Yes.
All right. Well, it's good to see everybody. Next time I see you, I'll be working there.
Great. Take care.
Bye-bye.
Let me call him. Oh, never mind. He texted. Hey, Greg.
Hey, guys.
All right. We're moving into executive session. I paused the recording. Are we off of?
I will end the stream on YouTube right now.
Okay. Just let us know when it's done.